Thank you so much for coming out. I'll try to keep this engaging because we're probably all a little bit tired from staying up too late last night. Um, but I certainly welcome your feedback. I'm always an advocate for trying to make the healthcare system work better and more efficiently. And one of my passions is working on things like the annex. So having you here tonight is helpful for me because I'd love to have your feedback on things that you might be finding are challenges or struggles. I'll start off by saying that I wish, if you don't have a primary care provider, I wish I could give you each a primary care provider. That would be lovely, and unfortunately, I won't be sending you off with a name attached to you, but I'm hoping that with the talk that I'm going to do tonight, that it'll help you with knowing where you can go to get care, where the service, like how you access the services that are available, and what those are. And so hopefully you find this helpful. And like I said, please ask questions along the way. If you have any, just put up your hand. So my background is that I was born and raised in Huntsville. So I am a longtime Huntsvillian. I went away to school for many years, and I've been back practicing in Huntsville for almost 20 years. I love Huntsville. It is an amazing place to live. I work in community practice. I work in the hospital. I used to work in long-term care. I'm a coroner, and I spend a lot of my time doing some of the administrative things like trying to do programming like the annex. I love Huntsville because it's a diverse place to work. It offers me all of these opportunities to do primary care in many different areas, and it's an amazing group of healthcare colleagues. We have an exceptional healthcare team here. If you've had to access it through the hospital or clinics or specialists or home care, it really is a team that really works well together. So I am proud of that and lucky to be a part of it. So what I hope tonight is that you'll walk away from this kind of understanding what services are available and how you might be able to access those if you don't have your own nurse practitioner or family physician. And if it's okay, if you're willing to share, I'm just curious to know and if you have a primary care provider, be it a physician or nurse practitioner. Does anybody here have one? Okay. In Toronto. Okay, so who has one in Muskoka? Okay, so a few of you do. Okay. And yes, that is a problem where many of people who have moved to Muskoka still have somebody 2 or 3 hours or farther away. And we consider those to be mostly unattached people because they're hard to access. Okay. So I'm sure you're all aware, otherwise you wouldn't be here, that we are in a healthcare crisis. And last time they counted in 2023, there's 2.5 million people in Ontario without a physician or nurse practitioner. That is projected to get higher in the next year or two with more physicians retiring. It may rise as high as 4.4 million. And so currently we're in need of about 3,500 practitioners, and we just cannot make them fast enough to meet that need. The picture on the top right is Walkerton. If you were watching the news around January of this year, people lining up in Walkerton for hours in the cold to try to be one of the people on a list of 500. And that's unfortunately not any kind of system that we want to set up as healthcare providers, but it's kind of the situation many of us have been left in. Wait times for seeing specialists are also very long. They have gotten a lot longer since 1993. It's about 222% longer from the time you get the referral to the time that you actually get the treatment from the specialist. And we're actually not doing as badly as other provinces. So Ontario, we're 23.6 months, where, in PEI and the East Coast, it's like 77.4. So these are really challenging times where you're not able to get the care that you need in a timely fashion. There's a lot of reasons that there's a shortage, and I'm sure none of these are new to you, but we do have a lot of physicians who are aging into retirement and transitioning out of practice, and that is not being met with people wanting to choose family practice as a career. And so as much as we need family physicians, we just don't have as much attraction for those residents who are choosing their specialty to want to go into family medicine. It's never been a sexy kind of profession. There hasn't been a ton of funding for primary care until now. And so that has left us with a gap in being able to provide that primary care access for patients, which I feel is really the key part of healthcare. Our population is also aging, so our patients are more complex, they take more time. And so navigating that as a family physician or nurse practitioner, we want to make sure that we can do that the best we can. So we sometimes have to limit the practices because we just want to make sure we look after the people we have. So there's different reasons. The other one I would say for Huntsville is that being in a rural community, we do a lot of things. So there are a lot of roles to be met. And one of the attractions to coming to a place like Muskoka is that you have the ability to be involved in different areas of practice. So if you have a physician, it's probably that your provider probably does more than one thing. And that's a perk of being in a rural community, but it also limits how many people you can actually take on because you've got other responsibilities. So I don't have all the answers on how to fix this. I do want to tell you that as a family physician, I hope and see a light at the end of the tunnel that we're going to get better at this, and that with some political changes that are coming, and I'll talk about that a bit later, that there is a better focus and a better awareness that this is a really key problem and we need to make sure that everyone has access to care. I wanted to just explain to you, I'm sure that some of you are aware that, trying to figure your way out of a healthcare problem, who do I go to, how do I get to this service, who's the right service provider, what phone number do I call, what service is this? It's very confusing. And I, even as a provider, find that difficult because things change quickly. Services change quickly, the names of places change quickly, and it's hard to keep up. So I can only imagine for you, if you're trying to figure this out yourself, it's really quite complicated. And so I had the privilege of going to Tokyo recently, and this is how I feel our healthcare system is. It's just like, it's a mess of stuff. It looks very scary and intimidating. And this is just the subway. There's a train map that goes on top of that. It's an amazing place to go. If you ever have a chance, I would highly recommend it. But when I went there and I saw this map, I'm like, that's how it feels. That's how it feels for lots of us, even us who are in it. So in January of 2025, some of you may know that the Minister of Health appointed Dr. Jane Philpott to lead what's called the Primary Care Action Plan. And the goal of that action plan is to attach 2 million people to a physician or a nurse practitioner in what we call a publicly funded healthcare team. So not just a doctor, but you'd have access to a dietitian, a therapist, nurses, nurse practitioners, who are all working together as a team to provide comprehensive care, which is what primary care is. It's like your first point of access, and it's got everything. So you can see all the different providers that will help you with that community-based care. And so what the hope is that we'll really focus our funding and our efforts in those primary care systems, so to the left there, which, like I said, hasn't really been a big focus of healthcare funding in the past. It's been very hospital-centric. It's like put all the money here and not as much focus on what we need to do preventatively. So this is really encouraging to me and hopefully to you that we're actually now recognizing how important this is, and as our medical learners come up and they understand this is a really important place for me to be to provide really effective care. So this is supposed to roll out. It's happening now, and I'll get to that a bit later as to how this is starting to show some actual change even within our own community. Primary care, I'm sure all of you know kind of roughly what that is, but when I went into it, it was family-based care. So I get to look after not just one person, but the people that they love and they live with, and from cradle to grave. And that's one of the perks of the job that I do is I get to see this whole perspective of the person and the environment they live in. And that's really helpful to making sure that they get the best care. So when we think of primary care, or when you think of primary care, most people are like doctor, nurse practitioner. And so we deal with acute illnesses, chronic illnesses, preventative care, like vaccinations, cancer screening, education. We do a lot of forums. And then we connect you to specialists when we need to, or connect you to other allied healthcare. So your physiotherapist, your speech therapist, those kinds of things. Nurse practitioners, anyone been to a nurse practitioner? Yeah, okay. So nurse practitioners have been around actually since the 1960s. And their role was formalized in around 1997 under what's called the Expanded Nursing Services for Patient Act. We have our own nurse practitioner clinic in Huntsville that's been open since 2011. And they basically operate the same as family physicians. So they used to not be able to do certain things like prescribe narcotics and order certain tests, but that role has expanded, allowing them to do pretty much all the things that I do. And is another access point if you're looking for a primary care nurse practitioner is a very reasonable option to be able to go and get the same kind of care. They have a bachelor's degree in nursing, and then they do a 2 years master's. So you'll find them in primary care. Sometimes you find them in hospital settings doing specialized programming, heart function clinics, and that kind of stuff. One that you may not be as familiar with is community paramedics. So community paramedics in Muskoka work for the District of Muskoka, and they actually do home-based care and clinic-based care. So we have one in the annex, and they do assessments for a sore throat, sore ear, blood pressure checking, that kind of thing. But they also go into the home. So super helpful when we're short on home care, that they will go out and do wellness checks and blood pressures, monitor your chronic diseases and that kind of thing. And that's been a really great addition to our team. They have a certain level of expertise, but that mobility of being on the road and coming to the patient is super helpful. Pharmacists as well have now expanded their role. So if any of you have been to your pharmacist, depending on which pharmacy, they can now be involved in diagnosis and treatment. So sometimes that's an option for people who have a sore throat or maybe a bladder infection or something, that certain pharmacies will be able to provide that care. And I'll go into that a bit more detail about what they can see and what they could do. The rest, I'm sure you're all aware of. We have social workers that do counseling, but also help navigate healthcare systems. And that's one of the things that we're looking at with the annex, is having someone to help people, especially unattached people, figure out, who do I go to next? Sometimes it requires a little bit more than a 15-minute visit with me to try to figure out, how do I get to this support that I need, and a little bit more one-on-one guidance. So we're hoping to be able to implement that soon. Home care, now called Ontario Health at Home, yet another one of those name changes where people kind of get confused. What is that? Where did home care go? This is the service where they have case managers who help coordinate home-based services. So if you need nursing at home after a surgery, you need someone to come in after you've been discharged from hospital, you need some allied health like physio or occupational therapy, they help to coordinate what services you'll get at home. And they also help do planning for long-term care applications if family members or yourself are trying to figure out how to navigate that. Does anybody have any idea how many of these services you can access without a doctor or nurse practitioner? So you can get all of these without me, except for me. But yeah, I think, it's hard to know where to necessarily go to find them, but these are all, and I'm going to go through this, is how do you find each of these kinds of services when you're kind of on your own. But we do have a lot. So in terms of family physicians and nurse practitioners, the way we're organized in Huntsville, and I'll speak mostly of Huntsville. Is there anyone outside of Huntsville, like Bracebridge? No? Okay, so I'm going to just speak mostly, there's a couple? Okay. So I haven't focused a lot on Bracebridge, but I'll touch on it a little bit. But all of the family physicians in Huntsville are part of something called the Algonquin Family Health Team. So there's about 26 of us right now. And we are affiliated with an allied health team of nurses, mental health counselors, geriatric team, and I'll get into this as well. And we also have different hubs. So there's one hub here, upstairs in the Summit Center. We have the Dorset Health Hub, and we also have the Annex. And all of that is under the umbrella of the Algonquin Family Health Team, providing primary care. We have the nurse practitioner clinic. which is also a healthcare team of nurse practitioners, nurses, dietitians, and mental health counselors. To the north of us, we have the Almaguin Highland Family Health Team, similar to Huntsville's, but smaller because the community is smaller. And to the south, we have Cottage Country Family Health Team, which is essentially a mirror image of Algonquin. So those are your kind of bigger primary care teams. There are also some community nursing clinics if anyone's ever had to go to Closing the Gap for nursing care. That is usually for people who are getting home care and they're able to get out of their home to go to the clinic. So a bit more mobile. So the Algonquin Family Health Team has many different providers, but also many services. And we are working hard at making sure these services are available not just to the patients of the physicians, but of unattached patients as a whole. And I think as the province recognizes that this population of people without a provider is growing, they need to support us in expanding these teams so we can give this to everybody, not just the ones who actually have a provider, who arguably are the ones who probably need it less than the ones who don't. So in terms of the services for the family health team, we have programs like for COPD, smoking cessation. We have a healthy seniors program that does exercise and education. We have a geriatric team that looks after seniors, people with early Parkinson's, early dementia, and a palliative care team that are very well resourced. And we have dietitians and counselors as well. So it's a very well-rounded healthcare team, and this is the direction that Ontario Health is leaning towards, because we can't have the physicians and nurse practitioners do all of the care. We really need to rely on all the different specialties and different health professionals to do their parts so that it's like shared work amongst the team. And that's why the focus, if you're listening to the news, it's a lot of team-based care, and that's where that's coming from. So that will allow physicians and nurse practitioners to take on more patients if they have the support of a team. I'm going to talk about the annex for a bit. And so has anyone been to the annex, just out of curiosity? Okay, a couple, yeah. So this is a partnership with the town of Huntsville and the District of Muskoka Community Paramedics and Algonquin Family Health Team. And so this clinic we started after COVID when we finished swabbing everybody and providing care. We had some opportunity to expand into just primary care in general. And we knew that there was a huge need as the number of people without a provider was growing and growing and growing. We didn't know where these people were going. And so we don't want people who don't have to go to Emerge to go there for their prescriptions or their chronic illnesses and things. And so this clinic was born out of that idea of we need to provide care for everybody because everyone deserves to have care. And so our primary focus when we first started was to make sure we looked after the people who got discharged from Emerge or from hospital. And we've expanded that now to everybody. So we try to see everything. Our problem now is there's just not enough of the team to look after all of the people who don't have someone. So we're working hard at that, and that's our push with the ministry to try to expand that team and push for more recruitment of primary care providers so that we have more availability for you. We recently surpassed 10,000 visits since we opened. We've been very successful in reducing Emerge visits. So we've been able to reduce Emerge visits by unattached patients by 50% in 2 years. So we're super proud of that. And when we have patients who come in and say, oh, thank goodness you're here, because otherwise I would have had to go to Emerge, we're just so happy that we can be there to do that. Our mandate really is to be available for everyone, but because the number is so large, we've had to limit it to people who don't have an Ontario-based provider, which is a bit difficult for us to swallow. But if you have a provider outside of Muskoka that you are still seeing, then that person really is the person who knows you best and the person who's going to provide you with the most continuity, which was really important for your own health. Because at the annex, we have different people coming and going. And so you may see me one day, you may see another doctor another day. We all communicate, but it's not the same as having the same one person who knows you. So if you have a provider that you are still seeing, we will basically steer you towards that provider. If you have a provider that you never see because you cannot get there, then I would consider that you detach from that person, and we will certainly look after you and get yourself on a wait list, which I'll talk about. And I know it's a kind of a scary place to be, to kind of detach from something that you might use sometime, but if, we have a lot of seniors who really just can't make the 2-hour drive to the city. And so we will do our very best to make sure that we can provide that care. So the question is, what is the cost savings if you go to the annex versus emerge? That's a very good question. I've never looked at it, but I can tell you, when you come and see a family physician or a nurse practitioner in the annex, it probably costs Ontario Health maybe tops $80. If you go to emerge, you're paying for the nurse, you're paying for the building, you're paying for the tests, you're paying for the lab person. So it's into the hundreds. I would say probably, like, we've had some American patients that I've seen, and you can easily get to $300 to $500, depending on what they're there for, right? So, yeah, and that's the other reason. I mean, certainly we want people to go to the right place for the right care. So if it's not emerge, we hope to be able to do that in a cost-efficient way in the right place, and faster sometimes. So just so people are aware how the annex works, we don't roster patients. So, we like I said, we do have rotating providers who come through. So if you come through and see me one day, I'm not going to be your ongoing physician. And that's somewhat difficult to explain, but the best way I can explain it is that if I take on 500 of you, that means there's 3,500 that I can't look after. So our premise is that we'll see as many people as we can, but we try to give access to the multiple thousands that we have here that don't have a provider. But we do everything there. So if you are looking for vaccination, if you're looking for cancer screening, if you need your medications renewed, you need vaccinations for your child, we do everything that your primary care provider would do, and make referrals to specialists if needed, and try to carry that through. Let me get that straight. So you're involved with the community paramedics. They're coming out as a service?
And they're saying, call the annex.
Okay.
The annex know that you're with the community paramedics.
Yeah.
You call and you leave a message. They say they're going to call you back in 2 days, and they don't.
So I can appreciate that's super frustrating. And yeah, the reality is we have hundreds of calls a day, and it's really challenging to meet everyone's needs. And we have one person sitting at that desk. So, we're severely under-resourced for the amount of care that's needed.
What do I do?
So talk to me after. I will try to figure it out. Like, we are doing our very best, and we have we have excellent staff, and we do have to do a lot of triaging for because our focus really has been make sure people don't go to emerge and try to prevent them from having to go back. Yeah. So my understanding, I've never been to the walk-in clinic in Bracebridge, but I have recently been told that one of the clinics actually has their own partly rostered patients. So they're limited in how much they can do in terms of walk-in. So they'll see their own, and then they have a little bit of time to do walk-in, but it's a little bit sporadic. You have to get there at a certain time. I don't think it's pre-booked. It's not? Okay. So we're pre-booked so that when you come, you're coming at the right time. So it's a little bit different in that it depends on the clinic, and I actually don't know the details of who they'll see, but I was recently told that the Bracebridge one will not see anyone for an issue that is chronic. So if you're going there for your diabetes, they're not necessarily going to see you. They might see you for a quick thing, but they're not going to see you for your ongoing high blood pressure and things like that. So it's always planned. Packed. Oh, yes. Yeah. So the annex is all pre-booked appointments. We don't have people just walking off the street because it just gets too chaotic. And it's a small, if you've ever been there, it's a small building and not a lot of parking. So when we designed it, we knew that if we did that, it would be chaos. So, yeah.
Is the annex open every day? I had read that it was just Monday to Thursday, but that expanded?
Monday to Thursday is pretty standard. We always are on the precipice of not having enough staff. So it's staffed by one nurse practitioner, one nurse, and rotating community physicians like myself, and there's a few other doctors in the community. So it really depends if our nurse practitioner is ill we're kind of like, we don't necessarily have the backup. So we are open most Fridays. And the odd time we have to close because we have, you know, an unforeseen issue, someone gets ill, you know. But for the most part, I would say most Fridays we are open. So what if you are going to the annex? A couple things that you'll be told when you book your appointment, you know, just so that you're going to get the best care, is plan ahead. If you have your medical records from your previous doctor, if you have electronic records, bring those, because chances are we have nothing. Unless you have a doctor that's recently retired from Huntsville, we do have access to their chart. So that is really helpful. We can just kind of carry on and see what Dr. Brule was doing. Always, always, always bring your pills. Our charts are not always up to date, so when we look at it, it may be very different than what you're carrying around in your bag. And I would say that too, it is very helpful when you show up in the hospital if you have your list of medications that are up to date, because we don't want to make mistakes. We don't want to put you on things that you're not on. And there is a lot of discrepancy when you look at the pharmacist record and what's in your purse and what's in my chart. So if you know what you're on and it's up to date, that is very helpful and reassuring for us as a provider. So please bring that and plan ahead. So we are struggling to see things quickly. So if you call the same day, we only have so many spots where we can squeeze you in. So if you are going to run out of your pills in a month, call before, like call 6 weeks ahead. Look at your bottle, if it's half full, start calling, because we are much more able to accommodate you 6 weeks ahead of time than 2 days before. You do have the option for medications to go through your pharmacist. So if you've run out of pills, unless they're narcotics, they can refill them. They will charge you $25. There's some restrictions, like if you're newly put on something, they may not be able to refill that. But as a last resort, they will refill your medications. We would, if you can afford it, rather you do that than go without them for like 3 months. And so just keep that in mind. You have that option as well. When you come, we'll also, I'm just in the process of developing like a patient booklet as well to help you guys keep track of when your appointments are, what tests were ordered at the annex, when's your mammogram due next. Like, this is a lot of information that I try to give you in 15 minutes. So I can appreciate that that's really challenging to absorb and retain. And so what I'm hoping to develop is some kind of like document that you can keep, which would be really helpful for those of you who are advocating for yourself, to be able to present as you go different places. So this is the walk-in clinics you were talking about. Those are the hours as far as I know them in South Muskoka and the Bracebridge Medical Center. Again, I think the Bracebridge Medical Center has recently changed their mandate, so I would call ahead of time instead of traveling down there, just to see if they will see you for your issue that you have. But yes, they've been around much longer than we have at the annex and have done a good job in providing that care to tourists and, you know, those of you who don't have a provider. It's just becoming harder and harder for them as well, because they've had retirements in that area as well, so they've got an influx too. Virtual care. So there actually are a lot of options that are OHIP covered virtual care. I've just put some of the main ones up here, and most of these are, you can call or you can go online and book these appointments on your own. And they are to see a physician or nurse practitioner who will do everything they can do virtually. So it's a little bit challenging if it's a rash or if it's something that is in a private area that you're not going to show on the screen. That's a little bit difficult. But if you're talking about your sore throat or you need to talk about your diabetes, this is a very reasonable place to access, and it is OHIP covered. Most of them have very flexible hours, evening hours, that kind of thing. So the first one is Central Region, which is our Ontario Health area, and obviously not for like life-threatening things, but you can book your own appointments online with these services. Health 811 is sort of similar to telehealth. So, you know, if you ever use telehealth, you would call, you know, we had a bloody nose or whatever, and you'll speak to a nurse and they will help you navigate what might be available to you, whether you should go to Emerge, that kind of thing. And that's an option too if you're kind of stuck and you're not sure you don't want to go to emerge and you can't get to the annex because it's the evening or whatever, certainly try that phone number as well. And then there's Telemed, MD, and Tia Health. And I think once you get access to the slides, I've put all the resources at the end of my presentation, so there's all the websites and the phone numbers and stuff. So if you need that, that will be in the slides. There are also children's rapid access clinics. The closest one, I think, is in Oro-Medonte. So if you have children or grandchildren who don't have a provider, there are also those clinics that will see specifically kids 18 and under, and it's run by a nurse practitioner. Ontario Health at Home is home care, formerly known as home care. You can self-refer to this. So if you are looking, you think you might need some rehab services, some nursing support, you need some personal care for, bathing, dressing, that kind of thing. Or you're looking at, like, how do I start planning for long-term care for my loved one? This phone number here you can call. There'll be a case manager you'll get connected to who will go through kind of what your needs are and see what you're eligible for. And there's all kinds of services that, although short-staffed, are somewhat available, and that's including like speech therapy, medical supplies, social work, dietitian, and like I talked about before, connections to nursing clinics. So if you have a wound that's not healing, they will connect you to Closing the Gap, so you can go there for dressing changes and things like that. One Kid's Place is essentially similar, like home-based care or school-based care for kids that is OHIP covered and access to your allied health, like your physios, your OTs, social work and speech. And I have the website for that as well. So pharmacists. I have not actually had too many people go to pharmacists for care, but here's the long list of things that they are now allowed to diagnose and treat. Not all pharmacies do this. So if you are planning to go to a pharmacy, I would call ahead and say, I have this issue, will somebody see me for this? There are some, I think Shoppers definitely does, and there are, I think, some pharmacies who will do it for patients that they have on their pharmacy roster. So if you get your medications there, they may be more apt to do this than you walking into some pharmacy where they don't know you. And that's just because they'll have your medical information and your medications, make sure that they're providing you with the safest care. The one thing I would say about pharmacist care is if you go and they give you eye drops for something, or they give you antibiotics for what they think is a bladder infection and it's not getting better, don't keep going back. Like, come and see someone like a nurse practitioner, a physician at the annex, because sometimes they don't do tests, so they don't check your urine, So I'm glad that they're there for certain things, but I would just caution you that if you don't, it doesn't feel right or it's not getting better, that you actually seek an alternate source of care. But they are super helpful. They will do diabetes education. They do immunizations now. The only ones they don't do are tetanus, polio, and measles. So that's a bit difficult for those of you who are kind of thinking about, oh, maybe I need my measles vaccination. You would need to come to the annex or talk to public health about their vaccination clinics if you're needing your measles vaccination. In terms of cost, the cost for the immunization is cost of the vaccination itself and $25 to have them administer it. So it's a bit of an expense, but if that's your easiest point to access it, it's a viable option as well. And that's not including things like flu shots and COVID shots. Those are generally, you don't have to pay for those, but if you're going for like Twinrix or something else that's not routine, shingles, and they'll do your meds check. So if you are on a bunch of things and you just want to make sure that they're not interacting, that they're still appropriate, they will go through all of your medications with you and give you a little report at the end. If there's things that need to be followed up with, if they say, hey, this is a concern, maybe you shouldn't be taking this, then please come to the annex and we'll have a look at it. In terms of accessing the allied health, dietitians you can access through the annex. So if you need a dietitian, we send you to the Algonquin Family Health Team dietitian. Physio and occupational and speech therapy, it's a long wait, but Ontario Health at Home does have access to those services if they feel like you're eligible for that. And then there's community paramedics. So if you needing a home visit, you can call the District of Muskoka. There's an extension for the community paramedics, and you can call and you can self-refer. If we see you at the annex and we feel like that's something that you'd benefit from, we just do the referral for you. Mental health services, we actually have quite a lot, and I've only kind of listed the ones, I've separated these by adult and child. The most common one that people may be familiar with is community mental health in Muskoka Parry Sound. They are located both in Huntsville, Bracebridge, and Sundridge, and they have walk-in clinics. So you don't need an appointment. If you're having an issue, you just show up and you'll be seen that night or day. They are 12 to 8 p.m., and in Huntsville, it's Mondays and Thursdays. They also offer a lot of services, so group counseling, legal support for people who have issues with some charges. They do addictions programming, and this is all for adults, so 16 and up. The Rapid Access Addiction Clinic is actually in the nurse practitioner-led clinic, which you can also self-refer to. So if you go to community mental health and you call them and you say, I need to access Rapid Addictions Clinic, they will direct you to the right place and help you get seen at the nurse practitioner clinic with their addictions counselors. There's also online services. So Ontario Structured Psychotherapy is put out by Ontario Health. They are generally like self-led resources with a coach or therapist online, but they also will do some virtual counseling as well. So some cognitive behavioral therapy for anxiety, depression, and that kind of thing. And some of it is self-guided and some of it is actually one-on-one. This is something you can self-refer to as well. So if you look up Ontario Structured Psychotherapy, you can self-refer and it's covered by OHIP. Connects Ontario is more of a navigation service. So it's not specifically direct counseling, but if you're not sure where to go and you've got a mental health or addictions issue, including gambling, you can call them, you can contact them, and they will help direct you to the resources that are local for you. You can also access mental health therapists through the annex. So if you're seen at the annex and you need counseling, we have counselors who are specific for unattached patients. So that's available as well. Other OHIP covered services, so there's CFS counseling and well-being services. They do virtual appointments for youth and adults. And if you're looking for private counseling, if you have coverage or you're able to afford it, I usually direct people to a site called psychologytoday.com. You can look up therapists anywhere in Ontario. You can localize it to Muskoka if you want to. And all of the therapists who are registered with that will pop up with a little bio of what they specialize in, the kind of work that they do, but they are privately paid. So 988 is a suicide crisis helpline. So instead of 911, if someone is having actual mental health crisis, this number you can call as well, or text and get 24-hour support if you're needing support for that. These are children's services, all OHIP covered as well. So MindAid is for under 30, and they don't do direct counseling either, but they will refer and connect people to therapists, help you find funding for therapy. They know different avenues to try to access funds if that's limited, and they deal with everything. Gender issues, addictions, trauma, grief, in terms of connecting to the appropriate services. And then similar to community mental health, the children's service is Simcoe Muskoka Family Connections. And they do kind of the same broad range of services that CMHA does, which is 12 weeks of intensive therapy, psychiatry assessment, psychology assessment. So they'll do brief and long-term counseling. And then there's lots of online resources. Kids Help Phone, probably most people are familiar with, is always a resource if people are needing just to reach out. Cancer screening. So what do you do about cancer screening if you don't have a doctor? So screening is starting to investigate when you don't have symptoms. So you're trying to find something before it becomes a problem. So usually if you have symptoms, that's not screening, that's diagnosing. And it's for people who are not at high risk. So if you have a strong family history of breast cancer, screening is not really the right word we're using for that. And the purpose of screening is to identify a disease early and treat something early to avoid progression. So breast cancer screening, if you are 40 and up, you can self-refer through the Ontario Breast Screening Program. It used to be 50 until last September. It was brought down to the age of 40. So you can refer yourself to that without a provider. Colon cancer screening, you can do if you're not high risk, so you haven't had polyps before, you don't have a first-degree relative with colon cancer. You can do a stool test called the FIT test, and you can request that directly from Health 811. So you can call there and say, I want a FIT test, and you'll get it in the mail, and you can send it back in the mail. The result comes to you in the mail. So we are working on this through the annex that if someone has a positive result, be it a mammogram or a FIT test, that result will come directly to be referred to us through the cancer program so that we can follow up with you and get you a colonoscopy, get you a breast biopsy, whatever that is. So that's the next thing we're working on at the annex, is following up some of the abnormal cancer screening tests. The lung cancer screening is one thing that's a little bit trickier because that's done by CT of your chest. So that generally needs a physician or nurse practitioner to order for you. So if you have a smoking history of more than 20 years or more, we would consider you to be at higher risk for lung cancer if you're between 55 and 80. So if you are fit in that category, I would encourage you, and if you want to do a CT of your chest, you can come to us and we will order that. So this is something that you can do online. It's called My Cancer IQ. And so if you go to that, you can screen yourself for how high risk you are for breast, colon, I think prostate. There's a big 10 different cancers, but the ones I usually highlight are breast and colon. And if you go on there, it'll ask you about your own personal history, who in your family has been affected, how old are you, what is your weight, and it will actually give you your personal risk compared to other people your age of having a cancer. So that sometimes helps you determine, like, should I have this test? Do I want to go for a colonoscopy? And I found that really helpful to give to my patients so that they kind of know the pros and cons of going and doing a screening test, because you can screen for something and get bad information too. So sometimes you get some result that you didn't want to know about, like, there's a spot in your liver that is not of consequence, but now you know about it, and now you've had 3 more CAT scans. So you always have to kind of weigh the pros and cons when you do a test of what am I going to find with this and what am I going to do with that information. And these screening questionnaires can be helpful to help you understand, why would I do a mammogram? What is the downside? What's my risk? Like I said, with the annex, with the cancer screening program, what I'm hoping to develop is like a Friday preventative care day. So for those who are just looking to update their cancer screening, come on that day, we'll order your tests, we'll follow it up. So stay tuned for that, because I haven't worked out the details, but I do want to make sure that people who don't have a provider are keeping up to date with their preventative care, because the last thing we want to do, like we kind of found with COVID, is people kind of stop doing things, and then we actually had an uptick in late diagnoses of things that we hadn't been testing for. So this is just a quick link to transgender and non-binary healthcare resources. So the Muskoka and Almaguin, Ontario Health Team, anybody ever heard of it? Okay, so it's a fairly new collaboration of the hospital, the family health teams, all different community providers, Alzheimer's Society, some of the long-term care homes. It's very large, and the purpose of it is to try to organize healthcare. So that's a really good resource if you look that up, and they have developed a resource of all the transgender and non-binary healthcare services in Muskoka. They also have on their website a lot of the links that I've provided for you guys as well tonight. When do you go to emerge? This is not an exhaustive list, but in general, if you have cold symptoms, cough, runny nose, sore throat, which can last, 7 to 10 days on average, that's not usually the thing that you want to go sit and emerge for. If you're having concerning symptoms, chest pain, neurologic symptoms like your arm is numb, symptoms of stroke, you're bleeding, obviously, loss of consciousness, confusion, those are the kind of things that we don't want you sitting at home waiting and wondering. These are things that we would want to see you for adults. And then for kids, any child under 3 months who has a fever, we should be seeing. Kids who are struggling to breathe, obviously. I mean, these seem pretty obvious, but sometimes when you're sitting at home, you're like, oh, I don't know if I should go. If it's one of these, then chances are you should be going. When to see primary care. So we are doing the less urgent things. This is probably not all news to you, but our most common thing that we probably see is back pain and infections. So we are there for all of those other non-urgent things. What can you do? So if you don't have a doctor, I've tried to make a little bit of a list of how you can advocate for yourself. So the first thing I would ask you to do is to make sure you're on a waiting list. I know it's not moving fast, but the purpose of being on a list is threefold. So being on a list is what the providers in Huntsville draw from. Yeah.
So being on a wait list when you are, so we're from down south.
Okay.
And we do have a healthcare providers about 3 hours away. And we would like to put our name on a list, but we're being told we have to give up our healthcare provider down there before we put our name on the list.
Right.
Now, I get the fact that we've got about 8,000 people here in Huntsville that don't have a primary health provider. Why can't you be 8,001, and when your number comes up, you give up that healthcare provider?
Yeah.
Why is that?
So good question. So if you didn't hear it, it's like, why do we have to detach from our current southern provider to get on the list? So the answer is you don't. So there's 2 lists. Actually, there's 3 lists. So the lists in Huntsville and Bracebridge and Almaguin, I think, I'm not totally sure about Almaguin, but certainly for Huntsville, we don't ask you to give up your provider. So you can get on the list and stay with your provider until you come up on our attachment list. I just took on 5 people today, and they still have a provider, and they're going to detach from them as soon as I get their paperwork. So what you're talking about is something called Healthcare Connect. So Healthcare Connect it's developed by Ontario Health, and it has been around for, I don't know, at least 10 years. And that is the one I think you're talking about, where they basically say you must de-roster from your provider elsewhere in Ontario to get on the Healthcare Connect list. They know that that is a barrier for people, and that is why their list is not as well used as ours is. And so it is there, and I would encourage you, if you are looking for a provider, to go on both. And the reason for that is we don't require you to de-roster, so you can certainly, there's no issue there. The one thing with Healthcare Connect that they're suggesting that you do is you talk to your provider in Southern Ontario and you say, look, I'm up in Huntsville. I still want to get care from you. And they can, if you're part of what's called a family health organization, they can de-roster you and still look after you. It just means that they are not paid capitation to look after you. But if you call them and you need an appointment, it's a billing thing. So you can still, I have students who go away to school. I de-roster them, but I still look after them when they come back, right? So it's what Healthcare Connect is suggesting is talk to your provider, see if they will still look after you, but not have you listed as their rostered active patient. It's a bit of terminology. But if you are not on a list, I would encourage you to do that, because it helps us with recruitment. So when we know that there's 1,000 people versus 4,000 people, it helps us plan for how many people we've got to recruit for. It helps us to say to people who are interested, look, we've got a practice of 1,000 patients sitting here ready for you. And that has helped us a lot. And it gives us a sense of what the urgency and the need is. It's also helped us in getting funding. And so I was going to talk about this a bit later, but there's been a recent, I don't know if you've heard, like a $1.8 billion investment in primary care that was announced a few weeks ago. And that funding is primary focus is to get people attached to a provider, which is part of that primary care action plan. And so in order to get people attached, they want to know how many people are unattached. So we don't know that unless you put your hand up and say, I need somebody. And so getting on a list helps us get funding, it helps us recruit, and it helps you get a provider locally. So I would, if you're, depending on where you live, Bracebridge people should sign up in Bracebridge, Huntsville people should sign up here. I wouldn't sign up in all 3 Muskoka areas. And I would look up Healthcare Connect and get registered on that, primarily for the purposes of telling the ministry, we got a problem here. We're very fortunate the town of Huntsville is hugely invested in primary care for this community. And so we work with them regularly, we meet with them regularly and say, okay, what is our next plan? That was put together quickly. It's been renovated 3 times. And we talked about renovating it again. And our thought was, you know what, we need to wait. We need to just have a bigger picture here. So yes, we absolutely know that it doesn't meet the need. Obviously the goal is we don't need it one day because everyone's attached to somebody and we don't actually have to have an unattached clinic. So this has always been seen as a temporary measure, but not a quick one that's going to get solved quickly. So we are working with the town to kind of see like what our options are to have a really accessible space that is bigger and attractive for new physicians to want to come to. So when you offer a space and say, look, come and work here, that's really what new providers are looking for, is a place to step into. The speech, because I hear it as I'm sitting in the other room, is sign up for the list, sign up for the list. So that you should have been told to sign up for it. And if you actually go to the Algonquin FHT site, that is where the list is. Yeah, most of the family doctors don't have their own list, and we tried to make this easier for people. Instead of calling 8 different offices, the purpose of having one list was call one place, go on one list, and we all take from that list. So the challenge is, as family doctors, we want to look after families. So sometimes we'll say, okay, you know what, I'm going to take your mom because I have everybody else in the family, and this just makes sense. So sometimes we have individual lists that are specific to families, but for the most part, we try to be impartial and make sure that everybody has access to that. So I'm not sure what other list you'd be on, maybe Healthcare Connect. Like I said, some of the providers might have a list of their own family members that they're following. But I would definitely go on to the algonquinfht.ca and it'll say, need a doctor? And you click on it. Yeah, I don't know. I took 4 or 5 people on. I think they've been on it for 2 or 3 years. I'm not totally sure. It's hard to tell because people get a little desperate and they put their names on and then they go and they move because it's been so long. And so some of the list is probably not true. The issue that we have is when we have physicians retiring, new people who come to town take over that practice. So we really, they may not take on the whole thing, right? So, and part of that is because, like I said earlier, we have a lot of, we got to cover the hospital. We got to look after the inpatients. We got to do emerge, Pardon? Well, so, there's lots of different areas to work in, right? And so it does mean sometimes that a practice that's gets taken over by 2 people. So what we really need is just a lot more bodies. And we're fortunate that we have a recruiter now who is really working hard on that.
Is there a way to find out if you're on the list or where you're on the list?
No one's actually asked me that. I guess I could probably find out. I might open a can of worms by doing that. But I think to find out if you're on the list, we should be able to find that out. So you can talk to me after and I can find out. Yeah.
My husband and I are on this, but I don't know which one it is.
Okay. So it's probably not Bracebridge and Gravenhurst, and I'm guessing it's not Almeguin. So, yeah, so that's the list I'm talking about. That's the first one up there. Yeah.
What's the other one?
The other one is Healthcare Connect.
Healthcare.
And that's a provincial wait list.
So you just Google Healthcare Connect.
Yeah. And it's in my slides later. Yeah.
And
I've got it in the slides here later as a resource, but you can Google it. Yeah. Yeah, so just clarifying, and I actually don't know a lot about it. I heard it was virtual. I believe it is a physician And I think it's somewhat private pay. Like, I think if you don't fill your prescriptions there, I think you have to pay for the visit, but don't quote me on that. I'm not entirely sure. The ones that I've listed up here are completely OHIP covered. And, you know, if it's virtual anyways, there's no need to go to IDA, but it's an option.
I understand that if you call to find out where you are on the list, it'll still put you at the bottom. Is that right?
Not that I'm aware of. I mean, I have not been told that, and I would never, I mean, I am the lead physician for the FIT, so I would never have said that was okay. But you can imagine having, you know, 5,000 people call and say, where am I on the list? It's not a manageable task. This is someone who is doing a full-time job and other things. So if it really is something you're not really sure if you're on the list, I'm happy to take your name tonight. I value that you've all showed up, so I will certainly look for you and see if you're on the list. I may not be able to tell you where you are on the list, but I will tell you if you are. Yeah, come and talk to me after. Yeah, I will see what I can do. I mean, like I said, I know that it's a challenging time, and I will try to help as much as I can. It's just, you know, you can only kind of help with the things that you only can help with the things you know about, right? So, we're out of time.
Yeah, can we maybe wrap it up at the hockey game in 0-0, just so you know. And Dr. Mark, you can stick around for a bit.
Sure.
Go and talk to her face to face and ask questions and that sort of thing. So thank you everyone for coming, and we'll come to Bracebridge next couple of weeks. Yes. Welcome there.